Welcome to the Refusion Podcast, where we transform patient care. Welcome to the deep dive. Here at Refusion, we're always looking at how practices like yours can really, flourish.
Mm-hmm.
And today, we're digging into something powerful, maybe a bit overlooked sometimes: patient referrals.
Absolutely. It's a huge potential growth area.
Think about if you needed a doctor, wouldn't you trust a friend's recommendation?
Yeah, almost certainly.
And the numbers back that up. We see that 42% of patients really value referrals from family and friends.
And even more, right? Like nearly 60% trust referrals from other healthcare pros.
Exactly, 58.08%. So in this deep dive, we want to explore how a structured referral program works, the real benefits, and give you some practical steps.
Mm-hmm.
So the question for you listening is, are you looking for a really cost-effective way to get new patients and also keep your current ones even more loyal?
That's the goal, isn't it? And referrals are, a fantastic answer to that challenge. So maybe let's start with the basics. What exactly is a patient referral program? Why should a practice really prioritize this?
Good place to start. So simply put, a patient referral is just, when a happy patient recommends your practice to someone else.
Right. Word of mouth.
Exactly. But a program that's about putting a system around it.
Yeah.
Encouraging it, making it easier, being proactive, not just waiting for it to happen.
Yes, structuring that encouragement. It's about strategically using those positive experiences. Sangeeta Kumar from Healthcare DMS, she put it really well.
What did she say?
She said something like, few strategies are as effective or overlooked. Nothing carries more influence than a trusted recommendation. And the key part, it helps attract new patients while reinforcing loyalty with existing ones.
And crucially, without that huge marketing spend.
Precisely, which is why we at Refusion see it as such smart, sustainable growth. It fits perfectly.
Okay, so the power's clear. High impact, low cost.
Mm-hmm.
But how does a practice actually, create an effective program? What are the key steps we'd recommend?
Well, the absolute foundation, the bedrock, has to be patient satisfaction. You can't really expect referrals if your patients aren't genuinely happy.
Right. Makes sense. Unhappy patients won't recommend you.
Exactly. So step one, honestly, look at your satisfaction levels. Are people actually happy enough to, put their own reputation on the line by recommending you?
You need those advocates. Okay, so satisfaction first. Assuming that's solid, what's next?
Then you need clear goals, specific, measurable goals. Don't just say more referrals.
Right, be concrete.
Yeah, like aim for maybe 10 new referral patients this quarter or whatever number makes sense for you. And this is crucial. Track it. You need to know if you're hitting those targets.
Okay, so assess satisfaction, set clear, trackable goals.
Mm-hmm.
Got it. Then how do you actually get the program moving?
Promotion. You gotta let people know it exists.
How do you do that effectively?
Simple things work. Maybe some signage in the waiting room, reminder cards at the front desk, and just have your staff mention it. Casually, We really appreciate it when patients recommend us.
Okay. And digital.
Oh, absolutely. Email campaigns, maybe SMS messages to satisfied patients asking if they know anyone who could benefit. Make it easy for them.
Right. Remove the friction.
Yeah.
Now, you also mentioned partnerships earlier. How does collaborating with other providers fit in?
That's another big piece. Building relationships with, say, specialists or primary care docs who offer different services. Cross referrals.
Okay.
Tyler Moman from Brooks Healing Center had a great point on this. He said, referrals act like a guiding hand for patients who might feel lost.
Yeah, healthcare can be confusing to navigate.
Totally. He said strong referral networks don't just help providers fill schedules. They create pathways for people to get the right care they need. For us at Refusion, enabling those connections is really important.
Okay, so building that trusted network. The next thing we often talk about is automation. Where does that fit?
Technology. Yeah, it can make things much smoother. You can use tools like Refusion, for instance, to automatically send out referral requests.
What did you send those?
Maybe after a patient gives positive feedback or after a successful treatment outcome. It ensures consistency, and it takes the burden off your staff.
Makes it easy for everyone. Okay, and the last step in building the program is recognizing how referrals boost loyalty. Tell me about that dynamic.
It's a really interesting psychological loop, actually. When a patient refers someone, they're essentially endorsing you publicly, even if just to one person.
Right, they're vouching for you.
Exactly. And that act reinforces their own positive feelings and commitment to your practice. Dr. Avi Israeli from Sage Dental NJ said it's not just a referral, it's a personal endorsement.
I like that framing.
Yeah, he said it builds firm, long-lasting relationships and drives sustained growth. The act of referring deepens their own loyalty.
That's powerful. Okay, so we've covered the how to set satisfaction, set goals, promote, partner up, automate, and understand the loyalty link. Now let's shift to the why. What are the big benefits a practice sees? What makes this worth the effort?
Oh, the benefits are significant. First off, obviously, growing your patient base. But it's the quality of those patients.
How so?
They come in with a level of trust already established because someone they know recommended you. They're often more engaged, more likely to stick around.
Right. They're not cold leads. They're warm introductions.
Exactly. And benefit two ties into what Tyler Bowman said. It simplifies decisions for new patients.
Less overwhelming.
Yes. Joshua Zeiss from Paramount Wellness Retreat mentioned how tough navigating options can be, especially for, say, mental health or addiction treatment. A referral is a clear signal, a trusted path.
That's a huge service to the patient right there, reducing that stress. What about specialist connections?
That's another key benefit. Referrals help efficiently match patients with the right specialists. Dr. Lav Kloshkaway gave an example, I think, about a young patient needing specific vision care. The referral got them there quickly.
So, better care coordination, essentially.
Yeah.
Faster access to the right expertise.
Precisely. Which leads to the next point. It guides patients to the right care overall. A structured system helps them navigate the whole landscape, get timely services.
Okay, and you mentioned trust earlier. How does that play out when the referred patient actually arrives?
Well, Aja Chavez from Mission Prep Healthcare observed that referred patients often come in better prepared and more open.
Because of that pre-existing trust.
Yeah, the trust sort of transfers from the referring source. They're often more willing to share and engage right from the start.
That must make the initial consultation much smoother.
Definitely. And then we circle back to loyalty, which is benefit number 6, really. We talked about the referrer's loyalty deepening, but it also builds loyalty in the new patient faster.
Because they started off with that trusted recommendation.
Exactly. It's this positive cycle. Trust leads to referrals. Referrals lead to more trust and loyalty, which leads to more referrals. It builds a really robust, sustainable practice.
And Sangeeta Kumar also mentioned credibility within the medical community, right? And better outcomes through shared history.
Yes, absolutely. Good point. When other doctors refer to you, it boosts your professional standing. And sharing patient history smoothly can definitely lead to better, more informed care.
Plus, we keep saying it, but it bears repeating. It's cost effective. You're getting high value, potentially long-term patients without massive ad spends.
Fundamentally, yes. Lower acquisition costs for a potentially more loyal patient, it's a win-win.
So wrapping this part up, the message seems clear. Patient referrals aren't just a nice to have. They're a core strategy for building a thriving practice built on earned trust.
Couldn't have said it better. They're a reflection of the great work you're already doing. Harnessing that is just smart practice management. It boosts credibility and brings in those quality leads.
So for everyone listening, we at Repugen really encourage you to consider this. How could a structured referral program change things for your practice, improve growth, strengthen that reputation?
And we're here to help make that happen. Our platform at Repugen is built specifically to automate and simplify this. If you want to see how easy it can be to turn your happy patients into referral sources,
Get in touch, right?
reach out or schedule a demo. We can show you how to expand that loyal base using automated campaigns. It's pretty powerful stuff.
Definitely. And maybe a final thought to leave everyone with. What if your happiest patients became your best, most effective marketing team? And essentially cost-free. Think about that untapped potential sitting right there in your existing relationships. It's significant.
It really is. Something we at Repugen love helping practices unlock.
Thanks for listening to the Repugen Podcast, your path to better healthcare.